Good day, ma'am. I am Abigail Agcaoili, and today I will be presenting to you the Partogram that you have given to us. But first, let me present to you the patient's data so that we can at least introduce the patient's background. So as you can see in this screen, the patient name is Mrs. C, Gravida 4, para 3+0, and her hospital number is 6639. The date of her admission is September 19, 2013. The time of her admission is 10, and the rupture of membrane began at 4. Before that, let me introduce to you the parameters of the Partogram. So, as you can see below is the fetal heart rate, or the recording of the fetal heart rate every 30 minutes. And below the fetal heart rate, we have the status of the membrane. If it is intact, denotes I. And if it is ruptured, we need to note the color of the amniotic fluid. And if it is clear, we need to denote C. If it is meconium stained, we need to denote M. And if it is blood stained, we need to denote B. And below the amniotic fluid, we have the molding. So molding is a term used in obstetrics to describe the degree of overlap of the fetal skull bones during labor. It is also an important parameter that helps healthcare providers assess the progress of labor and identify any potential complications. The next section consisting plotting for cervical dilatation and centimeter, or what we call the plot X, or the descent of head, which is the plot O. And below the cervical dilatation and the descent of the head is the uterine contraction, mentioned in squares of a vertical column in a 10 minutes interval, and fill it according to intensity of duration of contraction. The next section is the oxytocin units per liter, in which its dilutions or drops per minute to be infused. And then below is the drugs or the IV fluids in infusion. And then the next area for recording is the maternal pulse rate every 30 minutes, and the BP and every 2 hours. And the last section includes the urine analysis, consisting of the protein, the presence of acetone, and the volume. So as you can see in here is the fetal heart rate of the baby, wherein we need to measure the fetal heart rate of the baby using a fetal Doppler. So as you can see, so the fetal heart rate of the baby is gradually decreasing. And we can now move to the amniotic fluid, wherein you can see in here that there is a blood stained and the amniotic fluid at 15 military time, but at 16:30 military time, there is already a passage of meconium, or there is amniotic fluid meconium stained. And in the molding, you can see that the baby has a progression. So as you can see in here, in the picture, she also had a poor progress of labor, as indicated by slow cervical dilatation. Because initially, the cervix was 4 centimeter dilated, but at 14 military time, the cervix was 6 centimeter dilated, but then after at 16:30 military time, there is no progress of labor. So as you can see, there isn't really have a progress of especially with the descent of the head. So as you can see, it is not descending, it is not moving after how many hours, and still it is not moving. So in contraction, we don't have any problem. In contraction, it starts in a moderate but end in a good contraction. So there is no need to there is no problem in contraction. And as you can see, she doesn't have any oxytocin because she had a good contraction. So as I said a while ago, the contraction begins with moderate and then ends in a good contraction. So there is a good contraction in the there is a good contraction, so there is no need of administering oxytocin or IV drugs because we don't have any problem in contraction. So upon admission of Mrs. C, it reveals that the vital signs and the manifestations are normal. However, at 14 military time, the blood pressure decreased from 120/70 mmHg from initial blood pressure to 100/70, which indicates hypotension. So as you can see in the Partogram, that the pulse rate and the temperature of Mrs. C is within normal. So as you can see in here at 17 military time, a decision was taken to do a cesarean section, and this was done rapidly, or this was rapidly done. And was this a correct action? A decision to perform a cesarean section is correct. Why? Because the fetal condition is deteriorating, and a failure to progress despite at least 3 contractions in 10 minutes, each lasting more than 40 seconds, acetone in the urine, and a rising maternal pulse. So, what problems may be expected in the newborns? So, we have asphyxia and the meconium aspiration. So, what is asphyxia? So, we all know that asphyxia is asphyxia is when the body doesn't get enough oxygen. And as you can see in here, that the baby, or we have here an evidence that the baby has a meconium stain, and we need to expect that the baby has a expecting that the baby has a meconium aspiration. So if you find this finding with prior progress of labor, it indicates that the labor is at increased risk of becoming obstructed. And because the labor is obstructed, the patients undergo a cesarean section with live female infant with poor respiration effort and weighing 4,850 grams, which means that the infant is LGA. So, okay, for the final interpretation for the case of Mrs. C, I obtained that the final diagnosis is obstructed labor with fetal head 3/5 palpable above symphysis pubis, and it is supported by the descent of the head, which is not having any progress at all. And that's all. Thank you.